What's going on, everybody? This is Coach Marcon. Right here next to me is Coach Joe.
What's going on, everybody?
This is episode 9 of our podcast here today. And today we also have a special guest in the building here. We will show him later today here. But first things first, for our intro, we got our member of the week. Who is our member of the week?
Our member of the week this week is our awesome, lovely Sunita.
Sunita, mama. Woo, mama. So, reason we picked her this week is because about a couple weeks ago, she got like a big old cut on her hand. But, like, she's been putting in the work. Other than that, we had to, like, rearrange some of the workouts, but she's still putting in the time and effort. And also showing her daughter, Ruru, that is, like, you could be hurt and still be working out because you try and get your life better. So, shout out to mama like that. Shout out to Sunita. So, we have a special guest in the building here, Dr. John himself, John Dowdle here. So, he's going to be talking about the back. He's a specialist in orthopedic spine surgery up in Minnesota, and he does clinical residency here in Naples, Florida this year as well. So, without further ado, Mr. John Dowdle.
I've been doing spine care for 50 years, and during my career, I had this situation where I would give people medical terms for what was wrong with them, and they would have no clue what I was talking about. So I have developed a language that somebody who doesn't even speak English can get an interpretation and have some understanding of what's going on with their back. So that's what we're going to talk about today. I've been Project Evolve, I've been doing for 3 years or so, only 200 visits so far. So it's been a great way of keeping healthy, and being an old guy. It's important for me to keep my strength up. So I appreciated that very much. Okay, so the purpose is what we're doing here is I'm not talking about anything to sell anything. And I just want clean, clear communication. So I've had people who have an 8th grade education, barely know English, and I've had to tell them not in medical language, but in usable English language that they can understand what's going on with their back. So some patients don't know English, and I have an interpreter help me. And I used to tease my patients that I knew that I was fluent in Spanish, but I really knew 3 words: dolor, which means pain; mucho or poquito, a lot or a little, when I was pushing on them. And of course, they got a kick out of the fact that I didn't know any Spanish. So what we're going to talk about here is the natural structures of the back, and talk about abnormal structures and abnormal things happening. And we'll talk about the pain patterns, how we can tell from how people hurt, what's part of their back is causing them trouble. And we'll talk about diagnosis and imaging. I've got some imaging to actually take a look at so you can actually see what's going on. And then we'll talk about the treatments and sometimes the limitations and how you should be careful not to hurt yourself. So the first thing we're talking about is the anatomy. The back has got blocks of bone called the vertebrae, and in between that is a disc at each level, all the way up and down, from your head, your neck, middle of your back, and down to your lower back. So there's these blocks of bones, and that's the vertebrae. And the rings of bone, or the rings around the interval that's part of the disc. So I'm going to talk about that. So my explanation of this to my patients is that the ring here that's a normal disc, and the outside is fibers, and the middle, that blue part, is like the end of your nose. It has some structure, moves around a little bit. And so I've been talking about jelly donuts forever. So one of my patients one time called and needed an appointment to see me again. And then the nurse said, well, which doctor is it? And he says, I don't know, but we talked about donuts the whole time. So they knew oh yeah, I got to go see Dr. Dowdle. Anyway, so that's the structure between the bones, and it's made of those fibers. And the outer part is called the annulus. That's the fibers around. And the middle is this part is the nucleus. So we're going to the next one now. So this is a normal picture of this is an MRI scan right here. And in between it, you see these white slits right here. those are the discs. So a fresh donut with the ring of bone around it, and the ring of bone's got two little knuckle joints in it called facet joints. So that's the normal structure. So what we're looking for is this normal structure. The white part here is all the nerves going down your legs. And so all those little knuckle joints are in the back here. So this is a combination. So it's like a three-legged milking stool. The disc is in the front, a ring of bone, one of these knuckle joints on one side, one of the knuckle joints on the other side. So that's the normal structure. So here's a good picture. You can see the intervals, these white intervals, those are the discs in between. These are the nerves going down your legs. And actually, the spinal cord ends up here, and these are all the nerves going down. And it's got a great term for it. It's called the cauda equina. That's the horse's tail, because it's like a tail of a horse going down. And that's this part right here. So, and then the knuckle joints are back here. So we're going to see how these areas, how they change and what causes troubles in the future. So here's my three-legged stool. So when you're, this is the disc in the front, and these are the two knuckle joints. So when you move forward, you're putting pressure on the disc. When you're going to the right side, you're putting pressure on the disc and the knuckle joint on that side, and you do the same thing the other way. So that's the normal structure. So rotation, when you're rotating, you're not putting pressure on this one, but putting pressure on these two. So that's the normal things we're talking about. When you extend backwards, you're putting the knuckle joints to the maximum pressure. So sometimes when people have arthritis or changes there, you find that sometimes they're walking bent forward because they hurt when they go backwards because those knuckle joints cause troubles. So you see that particularly in some of the older patients. So there's two patterns of pain with your back usually. One is 80–90% is back pain and minimal leg pain, and it's back pain, and it causes difficulties with movement and activities, but it's mainly back pain. And so this is the beginning of it, is back pain, but often it starts with back pain, and a few days later, it's 80% leg pain. So when that happens, it's one of the diagnoses that comes from the back, and that's a herniated disc. So I'm going to show you that in a picture, what the picture looks like. So, so that's one pattern of pain, and that starts in the back, and a couple of days later, oh, my back doesn't hurt anymore, but I got this streak of pain down my leg, and that's the herniated disc. So the first thing I'm going to talk about is mostly back pain, and that'll be the first. Somebody comes in, they got back pain and minimal leg pain, and it's mainly pain with movement kind of things. So a lot of times somebody was doing heavy lifting at home and they come in, their back hurts. Well, that's usually a muscle strain type pattern, where for a couple of days you're sore and you just got to behave yourself, and that's temporary. That's not going to be something long-term. The next one is, this is one where it's mainly back pain and stays that way. There's not much leg pain, maybe some in the butt, but it's almost all it's back pain. And so that's what I tell people when they have a jelly donut and they leave it on the kitchen counter for a month. They come back in a month, it's hard and dried out and it doesn't bounce. And that is a degenerative or worn out disc. So the diagnosis, docs would say that you have a degenerative disc. Well, the patients say, you know, what the hell does that mean? Well, when I tell them you got a dried up donut, they have an understanding what I'm talking about. So we're going to talk about that for a minute now. So here you have, on this picture, you have fresh donuts, all white ones, fresh donuts here. And this one's black, and that is a worn out degenerative disc at that level. Okay, so you see somebody who has had an injury or something some long time ago, and they got a dried up donut, and it's going, the height is down. It's not as tall as this one, and it's black in color. Now, when you look at this one, that person has degenerative discs all up and down. Every single one of them is worn out. And they're not tall anymore. They're skinny. Look at how skinny that one is. So this is for somebody who has degenerative disc all over. Now, when you think about it, the disc is here, and these knuckle joints, they don't match up anymore. When they have fresh donuts, they go like this. But when they dried up and they get not as tall, they start overlapping, and you start getting more and more pain and more difficulties. So that's a degenerative disc, and that's a disease of common causes of that. It can be genetic. You see it in families. You participate in sports, some. Jobs, heavy lifting can cause some of it. And there's been studies on identical twins, and I'll tell that in a minute. But they took identical twins. One was a lawyer and one was a heavy construction worker, and they compared them at 60 years of age as to whether their discs were worn out or not, and they were identical. So that was more genetic rather than occupation. So that's sort of an interesting deal. So now when somebody has a pain pattern, mostly back, some buttock pain, so this oftentimes increases with standing because you're putting pressure on the facet joints, and you're bending forward a little bit when you're walking, so you're not putting as much pressure on those facet joints. And prolonged single position. So a lot of times I'll tell people who have a degenerative disc like this, you go on an airplane, get in an aisle seat so you can get up after an hour and move around. My wife has got one degenerative disc, and I used to make a little story up that when we're driving somewhere, every hour I'd pull over, I'd tell her she had to do 4 laps around the car so she wouldn't be so crabby when we got there. I was trying to save myself with that. So, but anyway, it's just a story. And people go home and they say, "Oh yeah, I know why I got to get up and move around." So it keep it from not bothering so much. So these are all ways to do it. Now, oftentimes people with degenerative disc will say the worst time of the day is when they get up in the morning. They've been stuck in one spot for a long time, and it hurts a lot to get up and get moving. And that's part of the degenerative disc. Riding a car, airplane, we talked about that. To decrease the pain, somebody does an office job and they're sitting all day. I tell them every hour on the hour, you get up and you'll walk around the office one time and then sit down again. So you're loosening up and moving around so you're not stuck in one place. So every hour, get out of the car, walk around the car 3 times. Stand too long, and then you sit down. So if you're standing in a line, sometimes if you're standing in a long line waiting for something, take a chair with you so you can sit down. And so you change positions. So that's how to manage a worn out disc. So that's degenerative disc. Now, treatment for it, there's a number of them. Treatment is physical therapy oftentimes to get in an exercise program like Encore and get exercise so that your muscles are strong so you can take away some of the pressure on the disc itself. And the medications, anti-inflammatory medicines can help. And if you've really got troubles and you're stuck and you can't get up straight, sometimes you can use a Medrol dose pack, which is a steroids, 6 pills one day, 5, 4, 3, 2, 1 over the next few days to get it to quiet down and go away. There are procedures that can be done. If those knuckle joints are hurting a bunch, and that's where the pain's coming from, you can block it with Novocaine. And if you do that twice and it works twice, you can actually take an instrument and heat it up and heat off that nerve so that nerve goes away. It's called a medial branch block and radio frequency procedure. It's a way of stopping those knuckle joints from hurting so much. And there is one option that sometimes I think in my practice, I've told more people that you don't need surgery than you need surgery. And fusion surgery is a huge deal. And it may make the x-ray look better, but it's a lot of times it's difficult to get people better with doing that. So you try to stay away from that if you can. All right, herniated disc. Now we'll talk about herniated disc. So that's pretty simple. When you bite into a jelly donut and it squirts out on your shirt, that's a herniated disc. So you see the picture here. So this is the center part, and it's squirted out, and it's right underneath that nerve, and that nerve is what's giving you pain. So it's 80–90% of its pain is in the leg or in the arm. When it's in your neck, it's in your arm. When it's in the when you got pain in your leg, it's coming from the lower back. So that's a herniated disc. Now, here's examples of that. So this is the normal canals. This is the nerves right here, and you see there's a white gap on either side. That's where the nerves are going out and going down the leg. So you see here, if you look at this one, these are all normal, but this one's skinny, and there's a speed bump coming out the back. And if you look here, that speed bump is sitting right there, and the hole where the nerve is going out on this side, it's open. On that side, there's a speed bump. And that speed bump puts pressure on the nerve, and that's what gives you the pain. So you have leg pain, it's in the front of my leg, and I can't walk. It's on the side pocket, side of the leg, top of the foot, or cheek of the butt, back of the leg, bottom of the foot. Those are the different nerves in the back that it could be. That's where that disc herniation is. So that's how you figure that out. And these are MRI scans. So if you have somebody coming with lots of pain in the leg, you got to pay attention. Now, one condition that's very unusual, I talked about the horse's tail, the cauda equina. If you get a disc herniation there, it gets to the place where you can't feel your legs at all, your bladder and bowel aren't working, and you need to be seen immediately and get that taken care of right away. If you leave it 12, 14, 24 hours, you're going to end up with permanent loss of bladder and leg control. So if you get that pain pattern, you got to be seen. So that's herniated disc. So I talk about pain pattern. Usually starts with back. 2 days later, it becomes almost all leg. Can develop leg numbness and weakness. And these are the nerves, different nerves. This is the front of the leg, the L4. This is the side pocket. This is the L5. And this is the cheek of the butt, back of the leg, top, bottom of the foot. So those are the different nerves. So you got to, it's on the left. You got which side it's on, and you look at your scan, and you see exactly where that disc is. It all corresponds with the symptoms. All right, treatment, no weakness. A lot of times you can manage the pain, pain medication, stay away from narcotics, but pain medication and minimal activity, and then 70% will reabsorb on their own. So now if you end up with actually numbness or weakness in the leg, then you have to say, if I leave that too long, it could be permanent. So you say, if you got weakness, you got to pay attention to it, do some medicine. If it doesn't get better, then you probably need to remove it. And so we talked about that when it's weakness. And then if left alone, the weakness could be permanent. And then the surgical way of doing it, you do it as an outpatient, quick recovery, and there's about a 10% chance you could blow another piece out of the same disc. So you got to think about that. All right, so here's a cervical spine. You see here all the discs, normal height. Here's the spinal cord going by there. This is all the spinal fluid right by the nerves. And you look here, you got a big disc that's sitting there, putting pressure on the spinal cord right there. That person would have arm weakness, some leg weakness. That needs to be taken care of right away. So that's that condition. You can see a big disc here on this side. So then there is a condition called spinal stenosis, and that's a narrowing of the canal. So if these knuckle joints get big, they can actually get big and form a tightness in the canal. And so actually I have a son who lives in New York. He's a painter. And he went by, he was walking down the street, and some old lady was walking toward him, and she goes like this and pointing to a guy who's sitting on the curb. And my son goes over to him and says, "What's going on?" He says, "Well, I can walk just about a block or two, and then I have to sit down. My legs go numb. If I sit here for 10, 15 minutes, I can walk again." And my son he says, well, how long have you had spinal stenosis? And the guy says, how the hell do you know I have spinal stenosis? He says, because I've heard about it from my dad. So this is, you sit and rest for 10 minutes and you're able to get walking again and the weakness returns. So you got to think about ways to treat that. And here's an example, drawing of it. Here's the normal canal with the normal knuckle joints on either side. These knuckle joints have gotten worn out and gotten bigger, and that makes the canal small. If this is a way of surgically treating it, where you go in and you trim these knuckle joints back and you get back to a normal canal. If you look at this one, you can see this is a normal canal coming down, and all of a sudden these knuckle joints are bigger on the outside, and that canal has gotten tight on that side. So that's spinal stenosis, and that's usually in the 60 to 80, 90 age group. So you think about that and pay attention to that. And it's mainly, I can walk just so far and I got weakness, and that's usually the symptoms. So this is the study I told you a little bit about. These are the two identical twins who one had a heavy construction job and one was a lawyer, and they had identical changes on their scan when they were 60. So that's why they think this is more genetic than occupation. So the questions. Any questions?
How does with people that are exercising that have those types of injuries and things like that, you've probably seen some of them here.
Yes.
Does strength training benefit those types of people?
Well, what you're trying to do is you're trying to, if you think about the disc being worn out, you're trying to make sure the muscles that are helping that they're strong enough to minimize the amount of pressure that's on the disc. But you also have to think about the fact that you don't want to go do heavy weightlifting where you're loading the disc if you know you got a bad disc. So it's maybe more squats and more other exercises that are not directly putting pressure on a worn out disc. So you just sort of have to work around some of that. But being good muscle strength helps have the muscles handle the pressure in your back and not having it put in to those worn out knuckle joints and worn out disc. So that's the workarounds.
What do you say to people that are afraid to exercise if they have those types of injuries? Because we get that a lot. Sometimes people are just worried they might have bulging discs or something like that, and they're afraid to even just to do body weight exercises or something like that.
Well, I love the term bulging disc. Bulging disc is not significant. Oh, it's like my gray hair doesn't cause me headaches. All right. A bulging disc is just a description, but it's not a degenerative disc. It's not degenerative, and it's not herniated. So a bulging disc is just more of a recognition that you got some gray hair, so that's not a real issue. And you can do the workarounds just to keep them in a safe zone, and it will minimize that. And there's no symptoms with a bulging disc. And that's one of those medical terms that people give, and they do a scan, you got a little bit of a bulge here. That has nothing to do with it. It's whether it's dried out or whether it's herniated, are the two things. And those you can pay attention to and do something about. A bulge you can't. I can't change my gray hair. It is what it is, So
Makes sense.
So that test too, was it, since it's mainly genetics, like I know my dad usually, I think he's starting to deal with some issues with that. So what is something like someone like kind of like in their maybe early 40s can start doing to like,
well, do the workarounds, do the other exercises that he can, rather than bending over and lifting that way, he can do squats and be lifting that way. I have a drawing here that I have that is available here, and it sort of brings all these things forward. At the bottom here, it says manage it, modify activities, a back brace, a back support if you're doing something heavy, anti-inflammatory medicines, and I call this the safe zone. The safe zone is plan on doing things to the letter you can. So my next door neighbor, he cuts his lawn. He does half of his front yard one day and the other half of it the next day. He stays in the safe zone. So the same thing with I had a guy who was doing floors in a school, and he'd do the floors, the whole school, all in one day. And he got to the place where he was missing 2 days of work afterwards. So then he came back, and a quarter one day and do some other things, a quarter the next day, and then he didn't miss any time from work. So you got to think about the safe zone and how to manage it. And so there's a couple things, fix it. There are some artificial discs that are now available, and a fusion of the operations. And then I have the spinal stenosis in the back, and about the flares of having back pain and back support. This one is a picture of a condition that happens in teenagers, growth, and this ring is supposed to heal in as you're growing, and sometimes it doesn't heal in all the way. And 6% of the population has this not healed, and it's called spondylolysis. That's the crack. And if you look at the side view, they're supposed to line up like this, but on the ones that have the crack, there's some that slide forward a little bit. That's called spondylolisthesis. So if you've got a teenager, they don't complain of back pain. If you've got a teenager and starts complaining about back pain, you need to have somebody be seen about that. And the only way you can see this and see it is do an MRI scan, find out there's a crack and it's new. You put them in a brace for 3 months, and it'll heal, and then you don't have to deal with it anymore. So there's some ways of doing that. Actually, I had a brother and sister. One was a basketball player, and she was a junior. And she came in, we did a scan. She had a crack in the bone like that. And so we put her in a brace. And I said, "Now, you can't play basketball for 3 months." And she was all in tears because she was going to lose her scholarship. And so what we did is, what's your free throw percentage? 60%. I said, okay, here's what you can do. With your brace on, you can stand on the free throw line, and they feed you the ball, and you practice your free throws. And you can't run after the ball. They have to feed you the ball. And then you see me in 3 months. We'll take another scan. Did another scan, and it was healed. And I said, so what's your percentage? 92% on her free throws. So then she was, this a terrible thing as a junior in high school. She went through it and got better with it. So there's ways of doing that. So you have to do the workarounds with kids and figure out the same thing with football. You take them out of doing the sport for 3 months, get the brace on all the time, and then you can take it off when you're taking a shower. Otherwise, it's on all the time. So that's this condition. So, all right, that's what I know about spine.
All right, everybody back on the team here. We just want to say thank you to John for explaining the great presentation you showed us here about the spine, how the herniated, bulging, degenerative disc, and how all of it's like kind of differentiated about it in terms of like some people here who kind of have like similar problems as well too. And kind of also like, even when you told me that story about a year ago too, I kind of tell them about that. It's like, well, how's your back feel about this? It's like, I was just like, you ever heard about the jelly donut thing? Is like, yeah, no. So I was like, tell them about that. So like, they kind of know about the story from you. So it's like pretty cool to kind of hear about that. And now you having the chance to kind of explain everybody to hear about this. So
now that you've seen my things, when I come here to work out, you got to be easy with me. None of this usual stuff.
Okay, maybe.
no.
But yeah, no, thank you so much for that. And like, what I took out of it most is like, the biggest thing is like, if you do have back issues, like definitely there's ways to work around it, and don't be afraid, because like even
tell us.
Yeah, and exactly, tell us. And there's ways, just like John was explaining with the jelly donut, and just make sure like you're getting it checked out and just working around it and stay in that safe zone. If you got to do kind of like you said, the lawn one day and do the lawn the next day, clean the house one day, do this the next day, just find ways to work around it and keep it up.
And once they understand what the structure of this is in usable terms, that they know what's going on, rather than the medical terms the doctors give them and say, I have no clue about that. This gives them a workaround, some ways to manage it. That's why I've done this over the years.
Yeah, that's perfect. Thank you so much.
Thank you. So we got these papers here at the gym here. So if you need it, we have a link that we can send it to you guys here. We have a couple copies here at the gym. We kind of show you, tell you guys about it. But if you want it, link, we'll send it to you right away. This is episode 9 of our podcast. Hope you enjoyed. whole presentation and everything. We'll see y'all
Next time.